Hey guys, Dr. Chad here today with our interesting case of the week. This is a case of a patient that had a lumbar surgery that was actually very successful, but it's a great case to share because just making the image look better doesn't mean the clinical symptoms go away. What I mean by that is as every nerve comes out through the hole or the foramen, just because you make the hole bigger and the nerve uncompressed doesn't mean symptoms go back to normal. So imagine if a wire in a wall was bent, just unbending it doesn't mean the electrical devices go back to normal. It's what you don't see that can kill you, right? The inside of the nerve can still be damaged, and just because you made the image look better doesn't mean the clinical symptoms go away. This x-ray that we're looking at is what's called a lateral film. So this is looking at the patient from the side. And before the patient had surgery, she had herniation at L4 and 5. That caused pain to shoot below her knee. You can see good placement of the pedicle screws and the hardware in the artificial displacement. When we look at the MRI, this is the segment that is fused, and you can see the screw kind of coming in and out as I toggle between these images. And again, this is an excellent surgery. The disc has been decompressed, the intradiscal spacer is in appropriate position, and the nerve is now freed. Even though this surgery went well, this patient continued to have severe pain going down her right leg. The numbness, the weakness got better, but the pain did not. For a patient like this, many of the simple options are no longer on the table. Doing steroid injection, rhizotomies, so forth, is not going to resolve the problem. Her options would be limited to medication management, nerve pain medicines such as gabapentin or Lyrica or Zonegran, or what I'm offering her, a spinal cord stimulator, is a long-term option. This is actually a model of a stimulator, and what we do with a stimulator is we insert wires above the area that's damaged, and the wire sends an electrical impulse to the spinal cord, basically intercepting the signal from that damaged nerve before it gets to her brain. What's really neat about this is the patient gets to try it out, and if it works, then we'll implant the medical device, much like a pacemaker, and she will have a controller that communicates to this battery under her skin where she can control the pain by turning it on and off. It's really neat because you're controlling pain with electricity instead of medication, steroids, and so forth. So again, this is not an example of a failed surgery, but unfortunately, just making an image or a disc problem go away doesn't always make the clinical symptoms go away. When I talk to my patients about surgery, I always try to set realistic expectations, and for this type of surgery, the numbness and weakness was the real reason she got the surgery, which is the improvement she received. But unfortunately, because the nerve was so severely impinged that the pain did not go away. I think she's going to do very well with a stimulator. She has her stimulator trial set up in a couple weeks, so time will tell. I hope this was helpful, and I hope the ongoing series is helpful. Again, if you have any questions, concerns, or comments, share your stories, ask me questions. I'm happy to give feedback, but I do hope this helps my patients as well as others dealing with spine issues in terms of making decisions as they move forward. Take care, guys. Thank you.